Hello, my name is Dr. Alieta Eck. I'm the past president of the Association of American Physicians and Surgeons. I'm a physician in private practice in central New Jersey, along with my husband, Dr. John Eck. In 2003, we started the Zarephath Health Center. It's a free clinic where we see the poor for free with the donated services of physicians and nurses, and we see between 300 and 400 patients per month. We started the Zarephath Health Center because we saw a need that wasn't being met. We saw people who were very frustrated because they had the government insurance, but they couldn't find a physician to take care of them. So we found that the poor are poor for very different reasons, and they need all kinds of help other than just medical care. But as far as insurance is concerned, the poor don't really need insurance. You need insurance if you have to protect your assets. What they need is medical care when they need medical care, and they need to know there's a place that they can go when they get sick and have no money to take care of themselves. And that's what we're there for. Currently, when the poor get sick, they go to the emergency room, and the taxpayers pay dearly for that. They go for rashes or they go for sore throats, and the average cost per visit is $1,000, all paid for by taxpayer money. The federal government has set up the federally qualified health centers where the cost is about $160 per patient visit, also way too expensive for the taxpayers. At our clinic, all with donated services, the physicians and nurses donating their time and all the support services are donated, it's only $13 per patient visit, paid for by private donations, no taxpayer money. As a physician who volunteers in a free clinic, the federal government gives me medical malpractice coverage for the work I do there. This frees me up to provide common sense medical care to my patients without ordering all those extra tests. And that makes us very efficient so that we can see between 300 and 400 patients per month. We're only open 12 hours a week. And the patients just are extremely grateful for what we can do for them. Many people believe that expanding Medicaid is the way to provide more insurance for more people, but this is really not the case. The Medicaid system is extremely broken, and it is frustrating to both patients and physicians. Patients can't find doctors who take it, and doctors won't take it because the regulations and the paperwork is just overwhelming. The Medicaid system seems to be a huge misuse of taxpayer dollars. In reviewing statehealthfacts.org, I found that $10.7 billion goes toward the Medicaid budget in New Jersey, when our total state budget is $33 billion, so that's a third. And if you look further, half of that goes to elder care, half goes to acute care, which includes hospitals and outpatient facilities. $2 billion of that goes to Medicaid managed care. $800 million goes to the federally qualified health centers. And when you assume that 20% pays for administration, it's $500 million going to administrators. And if you look at the physician's pay, it's $90 million. That goes for doctors, labs, and x-rays. So it frustrates the physicians because so little resources are going to pay for them to be able to provide the medical care, which is the whole purpose of the Medicaid system in the first place. So the Medicaid system is not the solution, and expanding it would not provide more medical care. So we believe that there needs to be many free clinics dotted throughout the state, not set up by the government, but set up by volunteers and churches and any civic groups that would do it. And we have an innovative solution to get more physicians to volunteer. And that would be to ask the state to cover the liability of any physician in their private practice who donates 4 hours a week in a non-government free clinic such as ours. This would increase the access to care for every specialty. It would provide a solution without involving the taxpayers and would save the taxpayers billions of dollars. Some people wonder about the medicines that we give. Sometimes we'll write prescriptions for the $4 prescriptions. We're very aware of what things cost because we know that it'll be a big burden on people who have very little funds. But we have found that the pharmaceutical companies are extremely generous, and they'll make donations of the medicines because they care about real charity. They want to know that it's going to take care of people who are in need. The pharmaceutical companies are very interested in seeing that the poor get the care that they need. Many people have thought that Obamacare would be the answer to taking care of the poor, but this is just not the case, because all that Obamacare will do is add layers and layers of more government bureaucracy on a healthcare system that is already overburdened. And just as I explained how the Medicaid system is inefficient, Obamacare will be more inefficient. In addition, the mandates and the meddling of the federal government on the physician-patient relationship is huge. Doctors are not going to be able to use their clinical judgment. They're going to be asked to follow algorithms and follow just the structures that are set up by the bureaucrats. And doctors won't be able to have choices as to what they do for patients, and patients won't have choices as to what doctors they can see. Obamacare will hurt the patient-physician relationship, and Obamacare will increase the meddling of the federal government in healthcare beyond what we've ever seen. Obamacare is not the solution, and expanding Medicaid is not the solution. We need common sense solutions. Our government already is spending way more than it takes in, and this cannot continue. So we believe that the free clinic approach would be a much better idea. Here in New Jersey, we've got legislators on both sides of the aisle who are very interested in our idea of the physicians providing the free care for medical malpractice protection. And we think this is an idea that should be expanded across the nation. To follow the progress of what we're doing in New Jersey, you can go to njaaps.org. Or as it expands nationwide, go to aapsonline.org. And you'll see that we can have a partnership between the government and physicians that makes real common sense, and the poor will get the care that they need.